What is one of the most intriguing emotions we all have experienced? An emotion that is often hidden and at the same time the cause for many other emotions that we experience. Yes, it is shame. Welcome to this podcast on shame. My partner for this podcast is Dr. Claude-Hélène. She is Professor for Industrial Psychology and People Management at the University of Johannesburg in South Africa. My name is Elisabeth Vanderheiden and I am the CEO of the Global Institute for Transcultural Research. Today we will discuss the dark and the bright side of shame. Transforming shame in cultural contexts. Shame seems to have a dark and a bright side. While in some cultures, shame seems to be a taboo that is negatively coded, often repressed, in other cultures, it is almost considered a virtue. Shame impacts on thoughts, feelings, and behavior, as well as on creativity. Shame is also present in dreams and can be a source of healing and reconstruction of the personality, as well as a depressing experience, which fosters anxiety and ill-being. Shame is a powerful emotion, which is associated with self-condemnation and impacts strongly on regulating social interactions in which a person or a group has violated a moral or social code. Recently, positive psychology began to explore shame from a health and resource-oriented perspective. This podcast provides an insight into shame and gives ideas on how to define shame as a health and transformative resource from different cultural perspectives. It further shows how individuals across cultures might work through the shadow side to experience the bright side of shame. This process to work through the pain and suffering of the challenging emotion can contribute to personal growth and development when the pain is acknowledged and transformed through a creative act. Claude, what is shame?
Shame is a deep-rooted emotion, hiding behind all kinds of negative emotions. It encompasses the whole of ourselves. It generates a wish to hide, to disappear, or even to die. Shame is the normal part of the human nature. It is also among the most intense and painful effects. Others, however, also stress positive implications, such as Wormser, who calls shame the guardian of human dignity. Thus, any effective therapy would benefit from an existential positive psychology perspective, which both normalizes shame and affirms that the greatest potential of growth only comes from the most intense pain. Shame develops early in life and accompanies individuals across their entire lives. Shame can be triggered by different life events and manifests differently depending on age, in various environments and cultures, influencing individual and social-cultural development. Further, individuals are prone to different categories of shame, such as, for example, body shame, group shame, empathetic shame, and intimacy shame, traumatic and moral shame, also depending on their personality and their social-cultural environment. Furthermore, shame has a female face, is a gender-responsive phenomenon. Tangney and Daring found that, regardless of age, females consistently report greater levels of shame than their male counterparts. Not only do women feel ashamed much more often and intensely than men, but they also experience other circumstances as causing shame than men. Therefore, it is important that individuals become aware of the proneness to their individual and socio-cultural categories of shame, embrace them and work with them towards developing them as a health and holistic development resource.
How are shame and culture connected?
According to the perspective that shame is a highly complex phenomenon that is contextually influenced, there is a need for different methods and interventions to work with shame on individual as well as collective levels. Thereby, culture plays an extraordinary role in the definition, development, and experience of shame and how it is addressed, managed, and transformed, while being a universal emotion and a social emotion. Over the past several decades, shame has been researched quite extensively in the context of culture and psychology. The first significant study on shame and culture identified shame as an important emotion within the anthropological study of Japanese and Western cultures. Based on Benedict's research, in which she divides cultures into guilt and shame cultures, many studies have replicated the view of the differentiation of cultures into shame and guilt cultures.
What does research tell us further about shame and culture?
Since this first groundbreaking study on shame and culture, shame has subsequently been defined as a cultural experience and as an expression of emotions which are connected to various associated cultural feelings and emotions. The word shame exists in various languages. On the basis of a study across 135 cultures, shame can be defined as a universal emotion. Anthropologists have identified the importance of the role of shame across cultures and argue that the experience of shame is universal. However, the experience of shame is nevertheless culture-specific in terms of its perception, experience, and expression. Within the context of culture, it is often emphasized as being a particularly social emotion. Additionally, recent research highlights the differences in the perception of shame across cultures and indicates that shame needs to be understood as socially and contextually defined. Greiner points out that the experience of shame is strongly connected to the cultural space a person is socialized and living in. Accordingly, shame and culture should also be viewed as connected to the influences of religion and the zeitgeist. Shame has often been researched in the context of comparisons of Western and Eastern viewpoints, and numerous studies analyze shame from cross-cultural perspectives, thus comparing shame in the context of different national contexts.
Can you give some examples?
In Western societies, a person who experiences high levels of shame is viewed as insecure and dependent on others, as well as having low self-esteem. According to Wong and Tsai, in many non-Western cultural contexts, shame is not only valued, but is also viewed as an appropriate emotional response to failure. The authors highlight that negatively evaluating the self in terms of shameful behavior or shame is not necessarily viewed as harmful to psychological well-being, but have informational and motivational significance in collective contexts rather than in individualistic ones. Studies have found that collectivistic cultures value shame as being more positive than individualistic cultures do. In a comparative study by Cole et al., the authors highlight that in Tamang and Brahman villages in Nepal, the people of Tamang tend to rebuke the angry child, but would reason with and yield to the child who appears ashamed. Brahmans, however, tended to respond to angry children, but would ignore shame. The authors therefore draw the conclusion that cultural heritage, religious differences, class and status, as well as majority and minority statuses, play a role in the respective perceptions of anger and shame.
And what do studies tell us about shame in the Americas?
Behavior that is seen as shameful is also culturally, contextually, and situationally bound. Farrell, for example, explores that shame and stigma attached to being fat within the American cultural context. In the context of a German school, issues that are experienced as shameful include shame related to achievement, motivation, and motives of endeavor. A study from Brazil shows that shaming is often used as a micropolitical concept in daily interactions, particularly with regard to topics of individualizing, psychologizing, and accepting responsibility and blame for illiteracy. Consequently, illiteracy is frequently associated with shame, as is the incorrect use of language. The relationship structuring character of shame has recently also been explored in other cultural contexts and involves indigenous knowledge, for example in Brazil, with regard to the Madiha Kulina indigenous group living in the southwestern Amazonian region. Here, exchange relationships, manako, are traditionally practiced. In this context, manako is to be understood as a universal principle that regulates the interaction in all areas. This principle of life is seen and experienced as a guarantee that there is harmony and a life of justice in the village community. If an individual in the village community does not live according to the life principle manako, he or she is expected to feel ashamed. At the same time, however, the entire collective is ashamed if manako is not lived.
And what do shame concepts look like in non-Western cultures?
Increasingly, non-Western concepts of shame are included in the research discourse on shame. While in Western contexts, cultural concepts of shame are more often negatively connotated, in other cultural contexts, concepts of shame are more often in positive than negative interpretative contexts, such as lacha in Hindi or Sanskrit, or malu in Indonesia and Malaysia.
How to deal with shame constructively?
In the past, the question of how to deal with shame on a practical level has been responded to by other researchers and practitioners, for example, Bradshaw, with regard to self-development and healing, or Brown, with specific regard to women, using a narrative approach to overcome shame. Brown emphasizes that by speaking about shame and the true feelings associated with shame, expressing emotions, a person builds connections and thereby overcomes and transforms shame. In an earlier work on shame in families, Fossum and Mason point out that families need to face shame across generations to overcome and transform shame within the family as a core unit of society. Again, the overall perspective is that shame needs to be uncovered, made visible, and be taken into view to work with it and overcome it, irrespective of whether it is on an individual or family level. Daring and Tangney in Shame in the Therapy Hour provide the reader with many practical and theoretically well-anchored ideas and methods of how to manage shame in therapeutical settings. We suggest here a positive psychology approach supported by the theory of Professor Paul Wong, in which we emphasize that shame can only become a health resource when individuals work through the existential points of shame, explore the deeper meaning of shame for themselves, and deal with the pain and suffering of shame to then evolve and develop based on the experience which confronted them essentially with their own shadow. Shame can then become a tool for self-development and support the creation of an increasing self-awareness.
Thank you, Claude. We would like to finish our podcast with an excerpt from a poem by Maya Angelou, taken from her poem, Still I Rise. Out of the huts of history's shame, I rise. Up from a past that's rooted in pain, I rise. I'm a black ocean, leaping and wide, welling and swelling, I bear in the tide. We thank you for listening, and we hope that this podcast will give you new insights into the dark and the bright side of shame, and inspires you to dive deeper into this fascinating topic.